In this lecture, we are going to discuss the maternal and child health care services. We mentioned in the primary health care services that one of the essential healthcare services is maternal and child health. It is important to provide these two groups with services in order to ascertain that the child will grow in a normal environment and he will develop as a normal adult. So it is important to provide healthcare services for the mother during a pregnancy to ensure that she will have a normal baby, and then also we are going to provide the child with a good healthcare services to ensure that he is growing to a normal or develop to a normal human. So at the end of this lecture, the student is able to understand why mothers and child health care services are important, and also to answer the question why the child and mother health care are both in one unit. Also, to understand the main goals of maternal and child health services, and to discuss the what is the mother and the newborn package, what does it involve, and to understand the components of maternal and child health, to describe family planning services, different types, and obstacles to family planning services, and also to understand the advantages or the benefits of breastfeeding, and also to discuss some of the obstetric complication may the mother face during pregnancy. Why it is important to have maternal and child health care services? What are the reasons for the provision of MCH services? Because women at reproductive age group and children under 5 of age constitute nearly two-thirds of the total population in the world. So they are bigger proportion of the population, and also women and children, they are both vulnerable groups. They are easily affected by certain factors which affect the health and the development of the children. Also, much of the mortality and morbidity are modifiable or preventable. The causes of death can be prevented or modified in these two groups by certain health program or health services. Also, it is estimated that three-quarters of the world population live in the developing countries. Of the total 16 million annual births around the world, it has been estimated that 15 million take place in the developing countries, especially in the poorer areas, so they are at risk of different types of problems in which may affect their health and their development. Also, it has been mentioned that early interventions in children help them have normal development. There are certain interventions early in life which may prevent many health problems and provide or it lead to the normal development of the child, such as, for example, the vaccination. We vaccinate children early in life, and we ensure that before the age of 5 years they complete the schedule of vaccination, and this will help in the prevention of different types of communicable diseases, which was the main causes of morbidity and mortality in the previous century. And there are large number for developmental assessment, for example, a provision of good nutritional supply for the children in order to ensure that they have normal development. Also, age structure of the population in the Arab region is significantly younger than the global average. It has been estimated that nearly 37% of the population, they are children under 15 years of age. In Jordan, according to the statistics of 2017, the demographic indicators estimated that nearly nearly 37% of children they are under the age of 5 years. So we have a good proportion of children. They need good health services in order to ensure that they have normal or grow normally. Children under 5 they are vulnerable group of population, and they are maybe exposed to different types of adverse events such as any change in the economic status or educational level of the family. It will affect the growth of the children because the economic status is related to the nutritional status and the provision of different materials in order to improve the quality of life. Also, the educational level of the family, whether the mother and the father, it affects the provision of good environment for good development. Also, there are certain cultural and traditional practices which may affect the development of these children, such as certain beliefs or values or some practices which may affect the growth or the development of these children. Environmental hygiene, the provision of a proper water supply or a good environment or good hygiene, house hygiene, it affect the health of the children because of, for example, overcrowding. It increase the liability or increase the transmission of respiratory infection, or the hygiene of the house or the hand washing or water supply. It lead to the exposure of different risk factors. For example, a lack of a proper water supply, it may lead to high risk of gastrointestinal infection, or lack of water, it may lead to also it affect the hygiene of the individuals. Also, the availability and the quality of the healthcare services. So not only the availability of the healthcare services, but the availability and the quality of the healthcare services, and also the accessibility of the healthcare services and the use of the healthcare services all affect the development of the children. In Jordan, at the year 2017, 2018, the total population was nearly 10 million, and the death of under 5 children is nearly 3,500, and the mortality rate for the children under 5 is nearly 16 death per thousand live birth, and infant mortality is near 14 per thousand live birth, neonatal mortality 9 death per thousand live births. So still we have some rates which need to be prevented or need to be improved. And also it has been estimated that the average number of children for each woman is nearly 3 children per woman. So still we have high fertility, and this will need special services in order to decrease the morbidity and mortality among children, and it is important to improve the health of women at reproductive age group. Mortality and morbidity rates of infants and children and the types of diseases during this period, they are variable according to different parts of the countries. In the developing countries, the causes of death and diseases differ from the causes of death from developed countries. So in general, children are vulnerable group, and they because at this period under 5 years of age, they undergo physical and mental development, which which call for preventive care to meet the biological and psychological need inherited in the process of the growth and development. So it is important to have a healthy environment in order to develop physically and mentally and psychologically. So we will have a normal child. That means we have a normal adult who grow to normal adult, and then he can contribute in the development of his country. Also, children health is also related to the health of the mother. If we have healthy mother, so we have healthy children. Fertility is high among women who live in the developing countries, who are usually live in poverty and who have low education. So women at the developing country, they are at risk of, or they usually have such conditions. For example, they have a frequent and excessive number of deliveries. Usually women living in poor countries or in developing countries, they have high fertility rate. Still they have high number of children, high number of pregnancies. So this will expose the woman to many risks during pregnancy and delivery. Also, pregnancy at early age or at late age. In developing countries, or especially in the poor families, usually they always they marry their children at young age group, and this is called before become 20. So the incidence of marriage before the age of 20 is high among females in the developing countries. This is called teenage pregnancy. So when they married early, they will have a pregnancy, and this is called the teenage pregnancy, which it is regarded as one of the causes of what is called high risk pregnancy. The younger age group, if the mother have children at younger age group, especially before the age of 20, so she is at higher risk of having many complications during pregnancy. So early pregnancy or teenage pregnancy, it is regarded as one of the high risk pregnancy. Also, usually they have a high number of children, so she remain to have a pregnancy even at older age group. So also older mother, they are at risk of having many complications during pregnancy, and especially after the age of 35. So women younger than 18 or younger than 20 years of age, or what is called teenage pregnancy, they are high risk mother. Also, if the mother have pregnancy after the age of 35 years, also she is regarded as high risk pregnancy. So pregnancy at younger age group or older age group of the mother, they regarded as high risk pregnancy. Also, many of women living in the poor countries or developing countries, they lack of antenatal care. Most of them, they don't attend or utilize the available antenatal care, and this will expose them to many risk factors. Deliveries also they will deliver in most of them, they deliver at home, or what is called undesirable conditions, unhygienic condition. In addition, most of these deliveries, they are attended by what is called the birth attendants, or what is called daya. And some of these daya, they are not trained for having or helping mother if she has a complication, or she is unaware about difficult labor or complicated labor, and they do not know when they will refer the mother if they have difficult delivery. So most of the women, they deliver at home under undesirable conditions. In addition, the child, they will cut the umbilical cord sometimes by an sterile cutter or knife, and this will lead or expose the baby to a neonatal tetanus, and we will talk about this later on. So most women are developing countries, they have sorry they deliver an undesirable condition, and this may lead to maternal death or complication during delivery, or the child may be exposed to different type of trauma during difficult labor and infections such as tetanus, neonatal tetanus. Also, they are liable to complications related to pregnancy and delivery, leading to maternal death or complication. So, primary healthcare services for women and children are among the services, selective services, which should be given a priority in developing countries. These services comprises the provision of first. So the primary healthcare services provided for the child and the mother, it is called maternal and child health, and this composed of first child health services. It is called in the past they call it under 5 clinic, because it provides services for children under 5, and they provide services for the newborn, and they follow up the child right after birth immediately in the neonatal period, and also they monitor the growth of the child. In this clinic there are special chart which are called the growth chart. A growth chart for the children. They measure the weight and the height and the head circumference around the head, because these are the main indicator for the growth of the child. So one of the important services is the provision of monitoring the growth and the development of the child. Also, early treatment of diarrhea. Early treatment of diarrhea, by the provision of the simple management, and by education of the mother about the feeding, and the provision of the dextrolite in order to prevent dehydration. Also, encourage the mother for breastfeeding, educate the mother during pregnancy and after, when they follow up for the child about the benefit of breastfeeding. Also, the provision of adequate weaning food. We advise the mother when they will wean their child, because breast milk will provide the child with good nutrition and immunity, especially for the first 6 months. But the child should be provided by or addition by what is called the complementary feeding, by giving food after the age of 4 or 6 months, in order to provide good nutrient for the baby. Also, immunization, which we have already discussed, the EPI, expanded program for immunization, and they provide the child with different types of immunization according to the immunization schedule, which we have already discussed. Also, early diagnosis and the treatment of respiratory infection, or what is called ARI. They train the doctors in the working in the primary healthcare services how to manage ARI, or acute respiratory tract infection, in the early stage, and they increase their awareness or educate doctors when they will refer the child to the hospital if they have severe respiratory tract infection. So main goals of child health services include the following. There are ultimate goals and the specific goals. The ultimate goals include health promotion. Every child should live and grow up in a family with love and security, in a healthy environment, with and the provision and adequate nutrition, in addition to the supervision of the health and the growth of the child, and efficient medical care, in order to provide him with to grow to adult with optimum physical, mental, and social well-being. So this is the ultimate goal. In order to have a healthy adult, with physical, mental, and social well-being, we should provide the family or educate the family how to take care of their children, and the provision of how to provide a good environment, healthy environment with a good nutrition, in addition to the health supervision and with medical care, in order to have a healthy adult. While the specific goals, what are the specific goals of the maternal for the child health? Sorry, first, the prevention and control of morbidity. It is important to prevent large number of diseases, and it is important early detection and treatment is very important for health problem in early in life. For example, diarrhea. It is important to prevent gastroenteritis. Most of children living in the developing countries, they have higher risk of having gastroenteritis or respiratory infection. So we educate the mother to breastfeed her baby. Also, the hygiene, drinking boiled clean water, proper water, and also educate the mother how to manage diarrhea and early stages to prevent the complication which is the dehydration. It is important to prevent dehydration among children who suffer from gastroenteritis. So it is important to prevent and control different types of diseases, and also by vaccination, as we mentioned, to prevent the infectious diseases or communicable diseases. Also, respiratory infection, by educate the mother to decrease the pollution or smoking among the family, because smoking increases the risk of the respiratory infection, and also provide the mother with education about the nutrition in order to prevent malnutrition. And also in some countries, they provide the mother with what is called the weaning food, the food when when the child is start to eat. So they provide him with certain weaning food to prevent malnutrition. Also, rehabilitation of the handicapped and disabled. It is important. Why? We always follow or make the developmental assessment of the child. We assess the growth of the child physically, mentally, and socially. So it is important. There are certain indicators which are used by the doctors in order to assess the growth of the child. We mentioned the growth chart for the weight and height and head circumference. This is for the normal, for the growth of the child, and they should measure these elements in every visit, and they draw a curve they plot a curve on the chart of the baby chart, the growth chart, to see whether the child is ascending growth, or if they found any descending in the rates of the, or in the weight or in the height. So it means that there is some problem, and we should pick this problem and try to modify or manage this problem. Also, it is important to assess his development, the vision and the hearing and the IQ, different examination to assess the physical activities of the baby, in order to detect. Sometimes some babies, they don't hear. So it is important to assess the hearing and the vision early in life and frequently, to detect any problem in the vision and in the hearing. Also, there is a special assessment for the IQ, for the mental development of the child. In addition, so it is important to follow these children physically, socially, and mentally, in order to reduce the morbidity and the mortality, and to ensure that the child is grown normally. Another part of the services is the maternal services. Maternal services are the services which are provided for the mother before pregnancy, during pregnancy, and after pregnancy, in the postpartum period. And this include antenatal care, which is the health care services which is provided for the mother during pregnancy. And there are different health services. We are going to discuss that. During the antenatal care, mothers should attend the antenatal care when she felt that she is pregnant, and register in the antenatal care services, and then she should come periodically to have certain services in order to ensure that she has normal delivery, and for early detection of any complication during pregnancy, and in order to manage the mother during pregnancy. And it is one of the important aspects during antenatal care is what is called a high risk pregnancy. There are certain factors which make the woman more risky during pregnancy, or have some risk factor during pregnancy which may affect her health or affect the health of the child. We are going to discuss this later. There are many factors which make the mother risky during pregnancy, and it is important to detect these women who have high risk, and they put on her record. So each woman attending the antenatal care, she has special records and files, and if she is a risky mother, they will put the letter R in red. So everybody come to see the file, he know that this mother is risky, and they wrote the cause of being high risk. Natal care, or the healthcare services during delivery. It is important to provide health services for the mother before pregnancy to ensure that she has a good health during pregnancy. Also, she should have services during delivery to ensure that she has safe delivery. Safe delivery, that there are no complication during delivery. She needs special healthcare services to ensure that she has normal vaginal delivery, or sometimes they have assisted vaginal delivery. They use certain material for her assistant. They assist her for having the baby, especially if she has some obstructed labor, by using what is called forceps delivery. And this is one of the factors which may affect also the health of the baby. So it is important to ensure that the child and the mother have a normal environment, and to have safe delivery. So there are certain services provided during delivery in order to ensure that she have a safe delivery and normal baby. And usually we always advise the mother to have her baby, or to deliver her baby at the hospital. It is important to deliver the baby at hospital to ensure that if she has any complication, so they can be managed and prevent a different complication. Postnatal care, which is the care which is provided, to the mother after delivery, in order to ensure that she has normal puerperal period, and also to provide her with to educate her to have breastfeeding, and also to provide her or with information about the family planning after having delivery. Also, protection of mothers, babies, and young children from deficiency state. It is important to provide the mother during pregnancy to have supplementation of iron and folic acid, or vitamins, or any elements which to prevent any deficiency during pregnancy, which may affect the health of the baby. Why mother and newborn package? There is what is called one of the service, mother newborn package. It in Jordan, because it is regarded as a developing country. It is facing the challenge of maternal and neonatal death. Still we have new death during the neonatal period So it is important to provide health services for the mother during pregnancy and delivery. The package, a newborn package, it is the services which are provided for the mother during pregnancy and for the child during the newborn period. So the death of the neonatal period can be a result of some major complication of the pregnancy, such as there are certain complications the mother have during pregnancy, such as hemorrhage. The mother is at risk of having hemorrhage at early as the starting of the pregnancy until the end of the pregnancy. So it is important to manage or prevent hemorrhage during pregnancy or any infection during a pregnancy. They are more liable to have, for example, a urinary tract infection. So it is important to early diagnose and manage any infection during pregnancy. Hypertensive disorder. Mothers during pregnancy, even they have no hypertension, but during pregnancy, some women develop hypertension during pregnancy, and some they are at risk of what is called difficult labor or obstructed labor, which end in sometimes in cesarean section. If there are certain reasons, different factors which make it difficult for the child to pass through the birth canal, so it is what is called obstructed labor. So they have an emergency cesarean section. Or one of the important complication of pregnancy is abortion. Some mothers they have abortion, so it is important to early manage or prevent abortion. Abortion is the expulsion of the fetus before 12 months. Before 12 weeks or during the first 3 months. It is called abortion. After that, it have another names. I don't want to give you different many terms by now. So abortion is the expulsion of the uterus contained before 12 months 12 weeks, sorry. So it is called abortion. It is important to prevent abortion. Women who survive such complication during pregnancy, they still suffer acute or chronic ill health or lifelong disability. There are some complications which occur during pregnancy or during labor, which may result in chronic complication. For some women, for example, develop anemia during pregnancy or hypertension. As I mentioned, some of women they persist to have this hypertension, or some women may develop gestational diabetes. Some women have gestational diabetes. If they sometimes they are not diabetic, but they have diabetes, so they need special care in order to prevent any complication. Some of women, because of the obstructed labor, some of the dia or birth attendant, they don't refer the woman to the hospital, so she may have complication. And because of the obstructed labor, this may cause what is called fistula, and this will end with your urethral fistula, and it will have a lifelong complication of the fistula, which is a condition which occur in many developing countries, for women in many developing countries. So the main goals of the mother and the newborn package are by the year, the goals which was put at the year 2014, that Jordan should achieve Jordan's Millennium Developmental Goal for further reduction in neonatal mortality. So the main goals for the mother newborn package is the reduction in neonatal mortality, which is termed as the Jordan's Millennium Developmental Goal number 4. And we have already discussed the Millennium Developmental Goal. So Millennium Developmental Goal number 4 is the reduction on neonatal mortality, and also the achievement of Millennium Developmental Goal number 5, which is further reduction in the maternal mortality. The complications which affect women during pregnancy and childbirth affect the fetus as well. So many neonatal deaths are direct consequences of poorly managed pregnancy and delivery. If the mother have complication during a pregnancy, so this will affect the health of the newborn, and it may cause neonatal death. Also infants who survive also the infants, if they survive, they will end sometimes in a degree of damage that renders their physical or mental disabled throughout their life. Some children or some women who have obstructed labor, so they will have what is called asphyxia. Asphyxia, that means reduction in the oxygen supply for the fetus, for the child, and this will affect the brain. If the brain is deprived from the oxygen for a few minutes, this will cause death of the brain cells, and this will lead to complication, and the child will develop mentally disabled because of birth trauma or because of the asphyxia. The causes are similar around the world, as well as in Jordan. Newborn babies die or are damaged because of prematurity, birth asphyxia, as we mentioned, and trauma or infection. One of the complication of some pregnancies is a prematurity. Prematurity, that means the women deliver before 36 weeks of gestation. You know that pregnancy is 40 weeks, and if the mother deliver the baby before 36 weeks, so that the baby is called a premature baby. And he is liable to large number of complications which may affect the development of the baby. Also birth asphyxia, as we mentioned, because of obstructed labor and decrease the oxygen supply to the brain. So the child will have asphyxia, and this will affect the development of the brain. And any trauma, there are large number of injuries where the baby may be exposed during delivery. Sometimes even they have some what is called dislocation or fracture of some of the ribs or the hands, because they are fragile, and because of some mechanical movement, they may have a fracture for the baby's bones. Pregnancy is not a disease. As a pregnancy, it is a physiological condition, but there are certain factors which may increase the risk of the mother for certain diseases, and may increase the morbidity, and some may cause morbidity and mortality. Many women, some of them may die because of complication of pregnancy or delivery, because of high blood pressure, as we mentioned, or because of bleeding or hemorrhage is one of the causes of maternal death. So it needs simple cost-effective intervention in order to prevent these complications. Most pregnancy-related complications can be effectively modifiable or prevented with simple material rather than using sophisticated or expensive technology. By simple maneuvers, it can manage the many complications without sophisticated intervention. Maternal and neonatal mortality can be reduced when communities are informed about the danger and signs and symptoms. It is important to inform the healthcare services or the DIAs for the danger, which we should inform them about the sign and the symptoms which are maybe related to danger or complication during the delivery or pregnancy. Also, it is important to provide a good quality healthcare services which should be available and accessible through primary healthcare services. And we mentioned that it is not only available, but it should be accessible for the women, and acceptable by the provision of healthcare services We mentioned that in the primary healthcare services. Also, it is important to know the referral system. It is important to know where are we going to refer the mother to the hospital if she has home delivery. So it is important to have information about this referral system. So this implies that safe motherhood intervention should be applied within a general health context that promotes equity in access and the quality of care. Making motherhood safe requires action on four fronts simultaneously. First, reducing number of high risk and unwanted pregnancy. It is important, as we mentioned, to determine who are the mother who are at high risk, and we mentioned that, and there are many causes. We are going to discuss that, and it is important to determine or prevent what is called the unwanted pregnancy. Many women, they don't use, for example, contraception, and they have what is called unplanned or unwanted pregnancy, and these women, they are at risk of having abortion. They may have illegal abortion or induced abortion, and this will expose the women to many complications of the abortion. So it is important to prevent the unplanned or unwanted pregnancy and have a good management to prevent the complication. Reducing the number of obstetric complication, it is important to advise the mother or women to have delivery at hospital in order to be aware about and early management and intervention to prevent any complication during delivery. Reducing case fatality rate in women with complication. Always we try to manage the women with different types of health problem in order to prevent death during pregnancy or delivery or puerperium. A proper management of high-risk neonate. Some of the neonates, as we mentioned, the low birth weight babies or the premature babies, or there are different complications which make the baby at high risk, so they need certain intervention. Also, increase the availability and accessibility of family planning information. It is important to provide family planning education and provision of family planning materials or pills or other types of family planning method in order to prevent the number of unwanted or unplanned pregnancy in order to reduce maternal death. The number and severity of obstetric complication may be reduced by. How can we reduce the complication during obstetrics or during pregnancy or during delivery? First, by ensuring that all women have access to quality antenatal care, we should we should ensure that all women should be provided by antenatal health care services. Right from the beginning, when they know that they are pregnant, they should be provided with a special antenatal care. Also, we should ensure that they deliver at hospital in order to prevent any complication, and also management during pregnancy and early detection and complication should be detected and should be managed. Also, special attention should be paid for a newborn who need resuscitation. We mentioned that some newborn, they are low birth weight or they are premature. They need special health care and resuscitation. And also we provide the mother with information about early breastfeeding, the provision of early breastfeeding from the first hour of life. The child should put on the breast in order to ensure that the baby will have breastfeeding. Also, we should provide a special or proper temperature for the baby, clean delivery, and cord care. The most important thing is to cut the umbilical cord with sterile scissor or any material. So it should be sterile, because if it is unsterile, this will cause infection of the umbilical stump, and this will lead to complication. And one of the important complication is, especially in the rural area or at home delivery, is the development of the neonatal tetanus, especially if the mother is have no immunity against tetanus to give to the child. So special attention will be also paid for individual who need special care, as we mentioned, the low birth weight babies. When the children born with the very low weight, less than 2.5 kilogram, they call low birth weight babies. If they deliver with less than 2.5 kilogram, so they need special care. Also the premature and the babies with asphyxia or with sepsis or infection. So basic maternity care comprises the following: the most important healthcare services for the mother, we mentioned that, but in general, antenatal care, we mentioned, provide special healthcare services during pregnancy. Also natal care during delivery, special health care during delivery. The postpartum care, which is to ensure that the baby have breastfeeding, and also some mother, if they have some complications such as hemorrhage or infections, they need special help and also support for breastfeeding. The antenatal care, what does it include? The antenatal care include that the goal of it reduce the number and severity of a pregnancy related complication, because if we follow the mother early in pregnancy until delivery, so we try to detect the complication and try to manage this complication in order to ensure that the baby will be monitored, the health and the baby, they will be monitored to decrease any risk for the baby and for the mother, such as early detection of anemia or any thyroid problem. So sometimes mother, they are provided with thyroxine during pregnancy if they have a problem with the thyroid, to prevent the criticism during the thyroid insufficiency for the children. It also provides the opportunity to offer prophylactic treatment such as iron and folic supplementation, folic acid supplementation, or other supplementation, vitamin D. Now they supplement the mother with vitamin D during pregnancy, or thyroxine, as we mentioned, or vitamins. So it is important to supply mother with certain minerals or materials or drugs. In addition, it facilitates the early detection and management or referral of the pregnancy related complication. If the mother is risky, so we are going to refer her to the hospital for special care. Mother newborn package intervention before and during pregnancy or antenatal care, it have information about family planning, sexual transmitted disease, also detection and prevention of family planning, sexual transmitted diseases or HIV prevention and management. There are, in developed country, they have high risk of sexual transmitted diseases during pregnancy, so it is important to prevent the infection to the baby. So introduction of early management and treatment to prevent the infection of the child or the baby. Tetanus toxoid immunization for the mother. We should be sure that all mothers are immunized against tetanus. If the mother is not sure about her vaccination status, we are going to vaccinate her before pregnancy or during pregnancy, and then we continue the schedule of vaccination for 5 doses. We are going to discuss that. So if the mother is not sure about her immunological status regarding tetanus, we are going to vaccinate the mother. We start during pregnancy and continue 5 doses. We continue the schedule of 5 doses even after pregnancy to ensure that she had the full vaccination. If she had the 5 doses of tetanus vaccine, so she will immune and she doesn't need a vaccination every pregnancy. Also, antenatal registration, she should be registered at the clinic and they make a file for her and putting all the notes, investigations and the follow-up notes in the card of the mother in order to follow her properly. Also, treatment of any condition such as diabetes or any infection or urinary tract infection or any health problem, they should be treated during pregnancy. And also advice regarding nutritional her nutrition and diet. And sometimes in some countries they supplement the mother with some nutritional additional supplementation. Also iron, folate, and vitamin D supplementation during pregnancy, as I mentioned. And also recognition or detection any complication which result in the high risk pregnancy, such as what is called eclampsia or preeclampsia, which is a condition which occurs during pregnancy or characterized by increase in the blood pressure, high blood pressure, and edema and proteinuria. These are the three condition which is called the eclampsia or preeclampsia. Or preeclamptic toxemia, which consists of hypertension, high blood pressure during pregnancy, edema, and proteinuria. So it is important for every visit we make general urine to detect any protein, albumin in the urine. Also, in addition, we detect for sugar for diabetes mellitus, and in order to early detection of complication. And other complications such as bleeding, abortion, anemia, or RH immunization, if there are different RH or what is called RH incompatibility. So it is important to know the RH of the mother and the husband in order to know what should be whether the baby will need NTD or not. During delivery, she should have safe atraumatic delivery. She should have safe and atraumatic delivery to ensure that we will have no complication during pregnancy detection when the mother have a complication during delivery in order to refer her to the hospital. Also, after delivery, we mentioned that a detection of any complication in the postmortem, any infection or bleeding. So we are going to manage her and also promote breastfeeding as immediately after birth, and in order also follow if the mother have any complication for the breast such as engorgement or a cracked nipple, and it is important to treat these complications. Also give her information about family planning as we mentioned, and prevention and treatment of sexual transmitted diseases and tetanus toxoid immunization. After delivery for the newborn, there are basic care for the newborn, prevention of, for example, resuscitation. Some babies, if they have complication in breathing or if they are under low birth weight or premature, they need resuscitation. Also prevention of hypothermia. They are sometimes babies they are exposed to low temperature and they will develop hypothermia or hypoglycemia sometimes. So it is important for early detection and also start exclusive breastfeeding immediately after birth, and nothing but only breast milk for the first 6 months. Even sometimes it is according to the new studies that the baby don't need even water, because if the mother have sufficient breast milk, so the baby will not need any nutrition, any other nutrient or water, because it is sufficient breast milk. And prevent infections such as ophthalmia neonatal. If the mother have infection, so when the baby pass through the birth canal, so he will attract this infection. And the most important infection, this is the ophthalmia neonatal, infection of the conjunctiva or the eyes. And this is mainly if the mother have some sexual transmitted disease such as infection by chlamydia trachomatis or Neisseria gonorrhea. They are the most important microorganism in causing causing ophthalmia neonatal, and this needs special treatment because if it is not treated properly, it will lead to blindness of the baby. So it is important to manage this health problem, which is ophthalmia neonatal. Also, cord infection. Many children, they have infection in the stump of the cord. So it is important to follow the umbilical cord and prevent any or treat any infection. Also, it is important to recognize and or early detection and management of high-risk neonates. As we mentioned, the low birth weight or premature baby, they need special care, care for individuals or babies with asphyxia or with have a sepsis or infection. There are large number of infection occur in the neonatal period. Family planning, it is important to have to assure that the mother have a family planning services after delivery, and so provide the mother with information about the family planning and provision of different types of family planning materials, such as contraceptive pill or other types such as the intrauterine contraceptive device or the other barriers which are used in order to prevent the occurrence of further pregnancy. So family planning reduces maternal mortality in several ways. First, by the reduction in the number of birth, because as a pregnancy, we mentioned that as a pregnancy it is normal physiological condition, but the mother at risk of having many complications during delivery or pregnancy. So it is important to reduce number of pregnancy to decrease the risk for the mother and decrease mother death. Also, it helps to reduce the mistimed pregnancy. Sometimes what is called mistimed, it is not at a proper time. Sometimes the family, they don't want the child at this time, or they don't want more children. So this will it is important to regulate the birth interval between the children in order to have a proper birth interval in order to have a proper development for their children. So it is important, for example, if the mother is very young, so it is still she is not developed well, so she cannot have a pregnancy, or she is at risk of having many complications due pregnancy. So it is indicated not to have a pregnancy, as we mentioned in earlier life, or if the mother have high parity means high number of children. Also it is important to have a family planning method to decrease the number of children, or if she is older age group, also because as we mentioned, she is also at risk of having many complications if she has a pregnancy at older age group. So family planning can help to reduce unwanted pregnancy, and which is regarded as a threat to the women's health, either because they may resort or unsafe abortion, because if the pregnancy is unwanted, so the women will have what is called unsafe abortion or illegal or induced abortion, which is related to or give rise to many complications, or such as infection or rupture uterus or death of the mother. So it is important to decrease the unwanted pregnancy. Also, it is important to have a good family planning method because it reduces the maternal mortality if she has longer birth interval. So it is important to provide information or education and communication. This is called information, education, communication. IEC provide the mother with information about how to birth spacing to increase the interval between their children, or birth timing, they at what time they want their children, or limiting the number of the family. So it is important to provide the mother about birth spacing and birth timing and limiting. Also, training the different healthcare provider about the use, how to provide provision of the information to mother, and let her choose freely the appropriate method she prefers. So it is important to have a good communication, interpersonal communication between the healthcare provider and the mother in order to have a good information and the provision of the appropriate type of contraception. So always provide her with information and let her choose freely, so she will use it, and this increase the use rate or utilization rate. Also, it is important to overcome some barrier. There are some barriers which may lead to women not to have family planning method. So it is important to determine what are the barriers or the obstacles for the use of the family planning method, and it is important to manage or overcome these obstacles in order to provide her or decrease the complication of pregnancy. So this barrier, maybe it is social, maybe the family or the husband, they don't want to use the family planning method, or cultural factor. They want large number of children, especially in the agricultural or rural area, to help them in farming, or financial. It is sometimes it is costly, but or sometimes organizational, because of the lack of a good organization in the family planning center, or lack of availability of the family planning method. So basic maternity care, as we mentioned, during delivery, it is important that we provide a proper delivery care or maternity care or delivery care at hospital, but still we have high number of mothers. We mentioned that they deliver at home. So it is important to provide the DIA or the birth attendant with certain information to educate them, to detect the risky mother and send them to the hospital for to complete their delivery if they have any complication. So it is important to train the birth attendant by certain information for the recognition of the complication which may occur during delivery, and we educate them to refer the mother to the hospital, because the risk of death at home delivery is higher if they have any complication, either because of hemorrhage or either because of the other complications such as obstructed labor. It is risky for the mother and for the baby. Many mothers lose their lives at home because the DIA or the traditional birth attendant, they do not refer her to the hospital, and the mother will die during pregnancy, during delivery, because of hemorrhage or because of traumatic delivery. Further, also it provide information about the sign and symptom which require to urgent assistance and when to refer the mother to the hospital. So always we encourage the mother to have hospital delivery. All pregnant mothers should have at least 4 antenatal visits. It is preferable to have at least 12 visits, but the total number 12 visits. But we sometimes in some countries where they have certain cultural factors, they cannot attend the healthcare services frequently. So it is preferable at least for visits to the antenatal care. So it is preferable to have a complete visits, but if they are unable, so at least 4 visits, so to enable the healthcare provider to detect certain complication and manage them. So at least 4 visits, and at least the length of the visit or the duration, not less than 20 minutes, in order to have a full assessment and management. So it is important, we mentioned that, to promotion and management and referral if the mother have complication, and it is important to assure, as we mentioned, about the tetanus toxoid immunization. Why we are insisting about the tetanus toxoid immunization? Because if the mother lack the immunity or she does not have immunity against tetanus, so the baby, and if the delivery occur in non-sterile condition, so the baby may have neonatal tetany, and it is one of the most important cause of neonatal death, which is the neonatal tetany. So it is important to ensure that the child or the mother is she deliver at in a sterile environment, in hospital or even at home, but in a sterile condition, and the umbilical cord should be cut by a sterile instrument, so the baby will not have neonatal tetany. So it is important to have prophylactic if the mother is not sure. We mentioned about her tetanus immunization. We will provide her with 5 doses of tetanus toxoid at different stages, and we are going to discuss that later. And we mentioned, so it is important to be ensure that the mother will deliver and clean delivery, clean hands, clean delivery in order, and cutting the cord with sterile instrument. It is important to ensure that she has safe delivery, and if she has a prolonged labor, it is important to educate the DIA or the traditional birth attendants to refer her to the hospital. So it is important to have early management for the baby and breastfeeding early in life. So breastfeeding, it is one of the important elements to provide the baby or provide the mother with information about the advantages and of the breastfeeding and when she will start breastfeeding. So breastfeeding, it is regarded as the first immunological defense for the baby, and to ensure that he have no infections and to grow properly and grow and develop normally. So the benefits are greatly enhanced if breastfeeding start as early as possible in the first or during the first hour after birth. So it is important to start the breastfeeding immediately after birth within the first 1 hour of life. With demand feeding and no substitute feeds. Only breastfeed without adding other feed. It should be exclusive breastfeeding at least for the first 6 months in order to ensure that the baby have adequate nutrient and have adequate immunology, especially in the first 6 months. After that, they should add what is called the weaning food or the supplementary food. Especially this is exclusive feeding only if the mother have sufficient breast milk. So, and it will substitute of others rather than giving other things during early life. So it is also important, and it is important to prevent breastfeeding. It is the first defense mechanism for the baby, prevent infection, and also it is important to prevent hypothermia, also prevent hypoglycemia or hypocalcemia, also prevent infections, and also prevent jaundice early in life. Apart from the nutritional superiority of breast milk, breastfeeding protects against infant death and morbidities. It is one of the important cause for prevention of death. In addition to the nutritional superiority, it is prevention of death by prevention of infections. Also, to prevent diarrhea and to prevent respiratory tract infections. Also, there are benefits for the mothers rather than the baby. Not only the baby have benefits from breast milk, but also the mother have benefits of breast milk or breastfeeding. It reduces the risk of postpartum hemorrhage, and also it contribute in uterus involution. Every time the child breastfeed, the uterus will contract and will reduce in its size to retain to its normal size before the pregnancy. Also, it lowers the risk of breast and ovarian cancer. It is one of the important factors that reduce the risk of the mother. If she breasts her babies, so it will decrease the risk of breast cancer later on in life or ovarian cancer. Also, it contributes to child spacing and reduce fertility. It is one of the some of the women, they have what is called lactating amenorrhea. They will not have period while they are lactating. So this will provide the mother with a natural contraception. So this is one of the important benefit of breastfeeding. It gives natural contraception or natural family planning. Many women who lactate their children, they will not have a period and they will not get a pregnancy while they are lactating. So it is regarded as one of the important family planning method or natural family planning method. Neonatal tetanus, the total global estimate of death from neonatal tetanus in the developing countries, it is still one of the important cause of death, and it about more than 500,000 of the newborn, they die because of neonatal tetanus. If the mother is not vaccinated against tetanus, so the child or the baby will have neonatal tetanus, especially if they are born in a place which is not clean or not sterile. So they will develop tetany. So all pregnant women should be sure that they are immunized against tetany. So in the developing countries, because they are not sure about their immunological status regarding tetany, so they provide 5 doses to the mother. The first dose, it is given as early in the first pregnancy. The first dose, it is given as early in the pregnancy. After the first trimester, they give the first dose, and after 1 month from the first dose, they give a second dose. So 2 doses given during pregnancy. Then after 6 months, after the second dose, they will give her after delivery. So sometimes they give her after delivery, or sometimes they give her the third dose at the subsequent pregnancy. And the fourth dose also, it is given 1 year after the third dose or during the subsequent pregnancy. And the fifth dose, it is given after the fourth dose, 1 year after the fourth dose, or after 1 year after on the next pregnancy. So every woman should have at least 5 doses. The first 2 doses during the pregnancy, then the subsequent third, fourth, and fifth dose, they are given 1 year apart or during subsequent pregnancies. The high-risk pregnancy, the most causes of high-risk pregnancy include either biological causes or medical causes or obstetric causes. So the biological causes which make the mother risky or having high-risk pregnancy is the age, as we mentioned, under 20 or under 18 or above than 35 years of age. So this is called, especially if she has her first child after the age of 35, or what is called old primary. So the age of the mother, the younger the mother, the higher the age of the mother, the older the mother, they are regarded as risk factors for having many complications during pregnancy or delivery. Birth interval. If the mother have subsequent pregnancies with a very short birth interval, she is more liable to have complications such as anemia and other complications which occur during pregnancy and delivery. Also, if the mother weight is less than 45 kilogram or overweight, both of them, they are at risk of having many complications. Also short stature of the mother. If the mother is short stature, if she is short, so she is more likely to have a cesarean section. Primigravida, every mother and during the first child prime gravidity, the first pregnancy, by the meaning of prime gravidity, during the first pregnancy, also she is liable to many complications, or when the mother is having more than 6 pregnancies, or what is called multi-gravide, more than 6 children, so also she is liable to have many complications. So this is the biological causes, while the medical causes, any woman who have diabetes or hypertension or sickle cell anemia or heart disease or malnutrition, all these factors, and there are large number of medical causes which make the woman at risk of having complication during pregnancy or delivery. Also obstetric history. Obstetric history, if the mother have previous history of complication, or if the mother have high blood pressure or preeclampsia or antepartum hemorrhage or hemorrhage during pregnancy, or postpartum hemorrhage, the history of having hemorrhage after delivery, or history of previous cesarean section, or RHI isoimmunization or RH incompatibility, or previous fetal loss or fetal death or abortion, or there are many complications during obstetric period which make the mother have make her at high risk of having complication. May be repeated, and thank you.